Welcome back. In our last video, we talked about several ways you can take care of your mental, spiritual, or physical self. We also share several examples of ways you can practice self-care. Although these things are helpful and can benefit you, sometimes you need more help. This is totally okay. There are maybe many things you still want to do and ways you want to continue having an active part in the life of your family and friends. There are several ways your medical team can help you do that. Sometimes that may mean other type of medication and or surgery. We'll be talking about what that looks like, as well as how you can plan for your future and for your family and loved ones. There are many treatments that can help you better manage your symptoms and give you an overall better quality of life. In some cases, these can even give you more time to spend with your loved ones and help you do more in your everyday life. These additional treatments your doctor might recommend include specific medication or procedures. The reason for this is that you may have a lot of pain or other symptoms that make life hard. For instance, a very common symptom is having pain in the stomach or the back. This pain can be constant or may come and go and be worse when you eat. This happens because when your cancer grows, it often impacts the nerves in your stomach. To treat this pain, your oncologist or one of your other doctors may give you Tylenol, nerve medications, or opioid pain medications like morphine. There are also procedures that can numb the nerves around the tumor if your pain is really bad. Having trouble eating is another common symptom. It may be that you just aren't hungry or feel like vomiting or simply feel full really quickly. This can be a problem because if you are not getting enough food to eat, you can lose a lot of weight and get weaker, making it hard for your body to fight the illness. This may happen because the tumor is growing in the stomach and keeps the food from becoming digested and used. It is important to tell your doctor as soon as you have problems eating so that your healthcare team can give you medication for pain or perform tests to see what else can be done, such as taking away a blockage that keeps your food from getting to the stomach. You may also need to meet with a nutritionist. The sooner your doctor knows, the sooner they can help you get the nutrition you need so you don't lose more weight. Another common symptom you may have has to do with your bowel movements or pooping. You may have runny poop or diarrhea or oily poop or be constipated and have a hard time being able to poop. This can happen because of all the medications you are taking or because of the chemo, or it could simply be that your pancreas can no longer do all it needs to do by itself. So you can't get the nutrition you need from the food you eat. Remember, your doctors can often give you medication to treat these symptoms and help your pancreas do what it needs to do. You may hear your care team refer to all the treatments we have just spoken about, palliative care or supportive care. Someone by the name of Dr. Jared Rubenstein explained what palliative care is with a short quote. The optimist says, "Your glass is half full." The pessimist says, "Your glass is half empty." However, the palliative care doctor reminds us, you still have plenty of water in your glass. Let's work together to make sure you savor every last drop. If your care team hasn't talked to you about the palliative care option and you are interested in learning more, make sure you ask about it. Remember that you deserve to know all your options so you can decide with your care team what is best for you. Another word that you might hear at some point is the word hospice, which is completely different from palliative care. Hospice refers to different services that give people more quality time to spend with their loved ones in a more comfortable setting when they get really sick. If you have questions about this, ask your community health worker In addition, our next video will have more information about this option. Another issue that is tough to talk about is when you keep getting sicker and it becomes hard for you to think clearly and make decisions about your care. The tough part is that it sneaks up on you. That's why it is important to plan and write down what is important for you and what you want while you have some energy to understand and think about what is going on. First of all, even if you have talked about this to someone, it is important to have it in writing. Things can sometimes suddenly move quickly. If you have not yet made clear in writing what you want, it can be hard for your loved ones to speak up for you. Having these documents will help your loved ones do exactly what you want. And it helps you to protect your family in these tough times when no one wants to talk about this. Doing it earlier on and having some signed documents make it official. So it needs to be available to your healthcare team because this is what they will use to make decisions about your care. The best way to make sure your wishes are respected in the state of California is filling out the 5 wishes, which will tell your doctors and any one of your care team what you want. This might seem like a lot to figure it out, but it's an important thing to complete early on to make sure you and your family are cared for even while you are receiving treatment. Our community health workers are prepared to talk to you about this when you are ready, but for the sake of your loved ones, please don't wait too long. Now, a quick word to your loved one accompanying you. In the moment, it may be hard to remember what your loved one wanted. There may be a lot to take in, especially as everyone is stressed and hurrying. Having their wishes already written down makes it easier for you to carry out what they want. There may also be situations where you can be there or you feel like your voice isn't being heard. It's important to have a written plan that tells the healthcare team who your loved one choose to make decisions for them. If they cannot do so any longer, this is not playing favorites. Someone has to do it, and having it in written makes it easier for the family, your loved one, and the entire healthcare team. Back to you, dear patient. Planning ahead doesn't mean you and your loved one are giving up. It is just a smart and loving way for you to continue to take care of yourself and your family. There are many resources to help you complete these important documents, and you can get them in whatever language you choose. In addition, our community health workers will be able to help you and your family get all the information you need, so you don't have to digging around for information. While maybe a small cost involved, it is far cheaper than not doing anything and having the government take over, which will happen if you do not decide for yourself. We know that this is a hard topic, but it's the only way to give you the power to make sure your wishes are respected and family members are cared for. It can help give everyone peace of mind no matter what happens. Taking the time to prepare these documents does not mean you are giving up. It means you care enough to plan for the future and to protect yourself and your loved ones.
Great.